Welcome back to Diabetic Class. This is Dr. G. I know it's been a long time, but took a little I wouldn't say vacation, but took a little hiatus. I've been traveling this week. I was in two different time zones. It was amazing. And Texas, you have amazing barbecue. So yeah. So let's get into it. And honestly, it's pretty much a 1 year anniversary of Diabetic Foot Files because I remember I need to go look back on the actual first date, but I know it was at the end of March. So happy 1 year anniversary to Diabetic Foot Files. So yay. Actually, the year has actually been good and only growth. So I'm very proud of this podcast and its platform to help educate people and hopefully to save limbs and lives. So today's episode, we're going to start in with our imagination. So imagine this. You step on a nail. It barely hurts, no bleeding, you shrug it off. On a side note, like I said, when you have neuropathy, you should check your feet every day. Okay? So I remember I had a patient that they consulted and he had a full blown nail in the bottom of like along his heel. And the patient did not know how long it was. And this is like years ago. But that's how severe neuropathy can be. You cannot feel it. Okay? But let's go back to our imaginative scenario. You step on a nail, it barely hurts, no bleeding, you shrug it off. A week later, your jaw feels tight, you can't fully open your mouth, then you have neck stiffness, then you have back arches that are uncontrollable. You are awake, fully awake, while your body locks into painful spasms. What do you think this is? What do you think the diagnosis is? It's not a horror movie, not an exorcism, it's tetanus. So now we're going to learn how tetanus is so important. So, what is tetanus? Tetanus is caused by a bacterium, Clostridium tetani, which is a gram-positive bacteria that is anaerobic, so it thrives in low oxygen areas, okay? And those are usually the ones also that causes like gas or neck. Form spores that can survive in soil for years. And these spores are everywhere in the soil, in the dust, in animal feces, and rusty objects. Not because of the rust, but because it's dirty and it's anaerobic. So how does tetanus work? Let's talk about the pathophysiology, forgive me. It's been a few days. So, this is where it gets fascinating, but unfortunately deadly. So, once inside the body, aka through a wound, right? Let's say through the nail, the Clostridium tetani produces a toxin called tetanospasmin. Okay? And this toxin travels along the nerves to your central nervous system. And what does this do? It blocks the inhibitory neurotransmitters, the GABA and the glycine, and the result is uncontrolled muscle contraction. So visualize it like this. Your brain says relax the muscle, but the signal never gets through. So the muscle stays contracted and that causes rigidity and spasming. So, what are some of the classic signs of tetanus and symptoms? So, early signs are jaw stiffness, lockjaw, and trismus, ne- neck, jaw stiffness, and neck stiffness, like I said, difficulty swallowing. And then the progression will be severe muscle spasms, arching of the back, sweating, fever, high blood pressure, and advanced is respiratory failure and death. So the incubation period for tetanus is usually 3 to 21 days. Okay, so that's about 3 weeks, right? 3 days to 3 weeks. That's easy to remember. 3, right? Average is 7 to 10 days. So the shorter the incubation for this tetanus, for the Clostridium tetani, the more severe the disease is. So, the history of tetanus has been known for thousands of years, described by Hippocrates, okay, forgive me for pronouncing wrong, linked to wounds in wars for centuries. And the scientific breakthrough was identified in the 1880, 1880 80s by author Nicolar, and the toxin was later identified by I am not going to try to pronounce the name, but we can look it up, okay? And this has led to the development of the tetanus antitoxin that eventually became a vaccine, okay? So what's in our tetanus shot? Because pretty much everybody's had a tetanus shot, right? The tetanus vaccine contains the tetanus toxoid. So the tetanus toxoid is an inactivated toxin, cannot cause the disease. It trains your immune system to recognize the tetanospasmin. Okay? So what are the types of tetanus vaccines? There's DTaP, that's when we're kids, okay? There's Tdap, that happens when you're a teen and adult years, plus it has the pertussis protection. And then there's the TD, which is the booster. Remember, you have to get a booster every 10 years. How often do you need a tetanus shot? Like I said, every 10 years. But if you get a dirty wound or a high risk wound, booster if your last shot was greater than 5 years ago. So that's whenever you see a patient have a dirty wound or open wound, you have to ask, "When's the last time you had a tetanus shot?" Okay? So, high risk wounds for tetanus, puncture wounds, of course, like nail and foot, animal bites, crush injuries, burns, necrotic tissue, chronic wounds like even diabetic ulcers. So anything that's really dirty, at very high risk of tetanus. Because remember, Clostridium tetani is everywhere. Now let's get into the nitty gritty. Tetanus and diabetic foot ulcers. So, because this is where our platform shines. So, diabetic foot ulcers, what do? They create a low oxygen environment, necrotic tissue, and poor circulation, which is a perfect environment for Clostridium tetani. So, the key risk factors are the neuropathy that the patient doesn't feel the injury, the delayed wound care because the patient isn't able to identify the injury, poor hygiene and contaminated wounds, okay? Because if it's a nail, it's going to be contaminated with dust, dirt, things like that. Even though tetanus is rare in developed countries, undiagnosed and unvaccinated patients are still at risk. That's why you always have to ask if you see a dirty wound, when's the last time you had a tetanus shot? So, tetanus protocol. If tetanus is suspected, this is a medical emergency. So, first wound care, immediate cleaning and debridement and removing of the necrotic tissue. 2, the tetanus immune globulin, so TIG. This neutralizes the circulating toxin. Then the vaccination. So yes, even if it's infected, because the disease does not give immunity, okay? So you need vaccination. Then antibiotics. Usually they use metronidazole, which is preferred. Penicillin is the alternative. Now, they also have to control the muscle spasms, which they use benzodiazepines for, okay? And supportive care like ICU monitoring and airway support, ventilator if needed, because remember, it does affect your airway and your ability to swallow. So let's do a classic nail and foot scenario. So you step on a nail, you ask the patient, when was your last tetanus shot? So if the patient said less than 5 years, right, usually safe. If it's greater than 5 years and it's a dirty wound, it needs a booster. If you don't know or the patient has never been vaccinated, they need the immunoglobulin, the TIG, and the vaccine, okay? When should you tell a doctor? Immediately. If you have a puncture wound, that's the whole point of checking your feet every day. I would check my feet twice a day, just like you brush your teeth twice a day, morning and night. Okay? That would save a lot of feet. Checking the bottom of your feet twice a day, morning and night. Check the bottom of your feet twice a day, morning and night. 60-second rule. All you have to do is see the reflection of the thing in the mirror or bring your foot up or get a family relative or somebody to look at your foot twice a day. I agree with twice a day because you don't know what's going to happen in the morning. You don't know what's going to happen in the evening. Okay. But you should tell your doctor if you have a dirty wound, if you have an animal bite, if your diabetic ulcer is worsening, and if you start having symptoms like jaw stiffness, muscle tightness, trouble swallowing. So, what are some famous historical cases of tetanus? Tetanus was a major killer in wars before vaccination. It had a high mortality rate in childbirth called neonatal tetanus and significant deaths before widespread immunization programs. So, why is tetanus still relevant today? So, even in 2026, wars are everywhere. Like we said, Clostridium tetani is everywhere. immunity wanes over time, and some adults do skip their boosters. So global cases still occur. So especially where vaccination access is limited. So clinical pearls for us to remember is tetanus is not just caused by rust, it's caused by bacteria in contaminated environments. Like we said, soil does anything, okay? And you cannot spread tetanus from person to person, okay? Defection does not give you immunity, okay? So saying that you had tetanus before, yeah, does not. And prevention is vaccination plus wound care, okay? And so hope everybody understands that tetanus doesn't need a large wound to cause symptoms and signs. It doesn't need a dramatic injury. It just needs the opportunity to get into your bloodstream, okay? And in a diabetic foot ulcer, especially with neuropathy, and you know what? I tell my patients all the time, "Do not walk barefoot." And they're like, "Okay, okay. Yeah, yeah, okay." But I'm telling you, don't walk barefoot. Okay? So in diabetic foot care and diabetic feet, these opportunities exist for these bacteria to thrive. So let's not give them the opportunity and keep that door closed for the bacteria to get in our feet. Okay? So I hope everybody liked this episode of Diabetic Foot Files. And this is Dr. G. I am so sorry for the whole hiatus. And take care of your feet because they take care of you.